Can normal brain activity be mistaken for a tumor on scans? Imagine looking at a brain scan and seeing what looks like a strange mass or unusual spot. It might be tempting to think it's a tumor, but sometimes, normal brain activity or other non-tumor factors can look similar on imaging tests. Magnetic resonance imaging and computed tomography scans are the main tools doctors use to find brain tumors. They look for abnormal tissue, unusual shapes, or areas that stand out from normal brain structures. But the brain is complex, and normal variations can sometimes mimic disease. Certain areas of the brain have natural differences that can appear unusual on scans. For example, regions with increased blood flow or heightened activity during specific tasks can produce signals that might look like abnormal growths. These are normal parts of how the brain functions and are not tumors. Additionally, other non-tumor conditions such as inflammation, infections, or blood flow issues can create lesions or changes in the brain's appearance. White matter hyperintensities, which are common in older adults or people with vascular issues, can sometimes be mistaken for tumors if the context isn't carefully considered. Technical issues can also lead to misinterpretation. Movement during scanning, artifacts from equipment, or suboptimal imaging settings can produce misleading images. Small or slow-growing tumors may not be obvious on initial scans, especially if they are early in development, which can add to the confusion. Sometimes, symptoms caused by tumors, like cognitive changes or mood shifts, can be mistaken for psychiatric conditions, delaying the diagnosis. Conversely, mental health issues can sometimes lead to unnecessary worry about brain scans. To avoid misdiagnosis, doctors combine imaging results with a detailed understanding of the patient's symptoms and medical history. They often use multiple imaging techniques, such as contrast-enhanced MRI, positron emission tomography scans, or functional MRI, to get a clearer picture. When scans are inconclusive, follow-up imaging or even a biopsy may be necessary to confirm whether a lesion is a tumor or something else. Recognizing common mimics and carefully correlating clinical findings help ensure accurate diagnosis. In summary, normal brain activity and certain non-tumor conditions can sometimes look like tumors on scans, but these are usually distinguishable with thorough evaluation. It's important to remember that imaging is just one part of diagnosis. Always consult healthcare professionals who can interpret results in the context of your overall health. Accurate diagnosis depends on a combination of clinical insight and advanced imaging techniques, helping to ensure you get the right treatment and support for your brain health.